Good evening, and thank you so much for being with us. Today, we are starting the 7th in a series of interviews. My name is Daniela Caruso. I direct the Center for the Study of Europe at Boston University, and I am as well a professor at the Law School of Boston University. So today we have one of the European Consuls General here in Boston speaking on the theme of solidarity at the time of COVID-19. Our interest has been to explore the various approaches to material solidarity taken by different European countries in response to the coronavirus pandemic. Over the last 2 weeks, we have spoken to the Consuls General of Greece, Italy, the United Kingdom, France, Ireland, and with the Honorary Consul of the Czech Republic. It is now my pleasure to introduce Nicole Menzenbach, the Consul General of Germany, to New England. The interview will be conducted by my Boston University colleague, Joseph Whipple. Let me briefly introduce them both. Nicole Menzenbach began her professional career working as senior advisor for Joschka Fischer, the former German Minister of Foreign Affairs. Incidentally, we hosted Joschka Fischer himself here at BU for a Europe Day lecture back in 2007. Nicole Menzenbach has held various roles within the Federal Ministry of Foreign Affairs, serving in such diverse places as Lisbon and New Delhi. From 2014 to 2017, Nicole was at the Federal Ministry of Foreign Affairs in Berlin as head of division for higher education and science. And for 2 years before that, she was senior advisor on the task force Afghanistan and Pakistan. Before taking up her post here in Boston in 2018, Nicole held a fellowship at the Weatherhead Center of Harvard University. The interviewer today, Joseph Whipple, is professor of the practice of international relations and a former CIA officer. He spent a 30-year career as an operations officer in the National Clandestine Service. Professor Whipple served in several European cities, including Bonn and Berlin, but also in Luxembourg, Madrid, Vienna, and many other interesting places. When working at the CIA headquarters, he was Chief of Europe Division and Director of Congressional Affairs. Prior to his arrival at Boston University, he held the Richard Helms Chair in the NCS training program. Professor Whipple has taught at BU since 2006 and speaks and writes widely on issues regarding intelligence. Thank you so much for being with us. Joseph, will you please begin?
Okay, good. Well, my first question is, why is Germany doing so well? Not so necessarily on infection rates. Infection rates are as high as just about anywhere, but its death rates are very low. A great statistic on that is Massachusetts has half the death rates of the Federal Republic of Germany. If you compare death rates in the UK, America, France, Italy, Spain, again, they're like a fourth or a fifth. What do you ascribe this really interesting statistics to? Because I watch the German news just about every night and they never mention it. I mean, they mention, and I like this, they mention how many people have been infected, how many people have died, how many people have been cured, gotten over the infection. I like that third statistic too. We don't tend to do that in the US. What do you ascribe that to? If I could ask.
So thank you. To begin with, thank you so much for having me. It's great to have the opportunity to share some information about Germany's approach to the pandemic. I think it's always difficult to compare the approach to the pandemic in different countries, because each country went into this nightmare with unique strength and very unique circumstances. So allow me to elaborate a little bit more on the German approach and what might have helped us to mitigate the disease. So to begin with, before the pandemic, Germany had already one of the highest numbers of intensive care beds per 100,000 people. And these capabilities were increased even further in the last week. So we were able from the very beginning to hospitalize people, even when they only had mild symptoms. And as you know, the German Center for Infection Research at the Charité in Berlin also developed the world's first diagnostic test. and for COVID-19. And we shared this test with the world through the World Health Organization. And so most of the laboratories in Germany already had test kits ready before the first case of COVID-19 was detected in Germany. So we were very well prepared for this. And overall, I think Germany also benefited tremendously from its healthcare system. So everyone has a health insurance. So people were not afraid to go to the doctor or to the hospital with mild symptoms and get the test, because they know there were no additional costs. So we did a lot of testing in the beginning. And I think this was really crucial and was really important to have to get a good overview of the situation in Germany. And of course, I also wanted to mention that the German government and the German people learned from what happened in Italy. And Italy was the first European country hit very badly by the coronavirus. And we saw the pictures on TV from people in the hospitals and people on the ventilator. And these pictures were so unimaginable and so shocking that we immediately knew that we had to act. And this thing is a very bad and dangerous virus. So the social distancing measures put in place by the German government was very early. And even before these measures were put in place, the German people stayed at home and acted in distancing, so to say. So all these measures will be in place till I think May the 3rd. And Angela Merkel last week agreed with the governors, the state governors, on measures how to reopen the country and the German economy. So shops with a floor space up to 800 square meter can open. School kids in grade 12 and grade 10 can go back to school again. I think museums may reopen again, and the car industry resumed their production. But large events will remain prohibited, as you know, because you watch every day the German news. Large events such as the Oktoberfest, we just canceled this very important festival in Bavaria. And I think soccer games will remain prohibited. And Angela Merkel will consult with the governors every 2 weeks on how these measures are working and maybe to make some adjustments. Angela Merkel has very high approval rates, so people trust in the government. And I think this is really, really important in these days. So the current situation is stable, I would say, and the curve is going down. That's good news.
You bring up an interesting aspect of this for me, and that is Germany has had a budgetary surplus for the past 8 years. And, you know, I think when you have a budgetary surplus, you can fund services with more flexibility than if you're constantly in a deficit situation. So I'm wondering if, you know, the German healthcare service has, you know, benefited from this added funding over the past 8 years, as well as good management of the healthcare system. You mentioned something like the beds, for instance, getting ready for things that are going to happen, not necessarily for things that are happening right now.
So in Germany, we have a welfare state. So Germans pay more taxes because of our social welfare system. Because we strongly believe that on a very fundamental level, that everyone's basic needs should be taken care of, especially in health and education. So our healthcare system was, as you said, very good, very well funded. I think this culture of solidarity, of a welfare state, helped us to mitigate the economic effects of the COVID-19 pandemic. So we have a program called Kurzarbeit. It's short-time working that helped us coping, that already helped us coping the 2008 and 9 financial crisis. So under this system, employees are not laid off, but work shorter hours, and the government pays a part of the salary. So the economic burden is shared by the company, by the employee, and by the government. And this morning I read in the newspaper that there are now more than 10 million employees in this Kurzarbeit. And so the state, we had the last years, you know, we saved the taxpayers' money, and we were, and our, you know, the finance minister has enough money to, in these really unprecedented times, to give this to the people and to, you know, mitigate, to reduce the economic effects of this crisis.
Well, when I first came to Washington, D.C., there was a preacher in downtown Washington. A minister used to say, the root of all evil is the lack of money. So maybe you know, that certainly is important in something like a decent healthcare system. I think one of the things that has impressed me is the degree of agreement between the various governors, who generally are either Christian Democrats or social democrats, but including a Lincoln, a leftist, and a Green governor. And what do you ascribe this to? Interesting also is that two of these people want to become the crown prince. And the health minister wants to become the crown prince too. So you could also suggest who you think is going to be the next crown prince. And so on. But could you comment on that?
Yeah, that's it's great to see that the state governors, they're working together, and they have a great sense of consensus. And of course, every state in Germany is hit differently. So in the south of Germany, because of the border to Austria and Italy, they were hit a little bit, it was harder than, for example, in eastern Germany. Yeah, it's good to see that there's a consensus. There's a lot of trust in the federal government. This morning I saw a press conference with the chancellor, with the state governor of Bavaria and from Hamburg, and so they are very much in line. They are very constructive, and that's so important. That's so important in these days, and this is why the German people have a lot of trust, in the governments, in the state governments, and in the federal government.
You know, that's interesting, because before the coronavirus, when they did a public opinion polls, how well do you think the government is doing? They got about 1/3. After the coronavirus, it's 2/3. Dr. Merkel's support is around 80% now. And that brings me to an interesting thing about, you know, the press. A lot of times dissatisfaction, I feel, is artificial, not necessarily there, but people are almost driven into dissatisfaction or enticed into dissatisfaction. And it's a problem for democracy, actually, because it's a pretty well-governed country.
Absolutely.
Yeah.
Absolutely.
Yeah.
And this strict social distancing measures is a problem for democracy, of course. You know, you can't gather, you can't demonstrate, you can't go to the street, and it's really very difficult. And Angela Merkel, because she is someone from the eastern, you know, former DDR, she grown up in the GDR. She said this was one of her most difficult decisions to put this in place, because it's you know, to cut off more or less the freedom of a society and the rights, the civil rights, is it's not easy. But we know it's just in these days, and we know it is important to act.
There's been, if there has been criticism, it's been more of a lack of solidarity within the European Union. That everybody is concentrating on themselves. There has been a debate on whether to, you know, issue a euro type of bond, or whether to do this with the, you know, the stability fund. And even Dr. von der Leyen, you know, the EU commissioner, you know, noted that, you know, we could have probably done better on this. And it's almost one of those things that, you know, all right, we're ready to give you money, but there's also reforms necessary. Is there something lacking in this? Is there a way of projecting, you know, greater solidarity within the various European countries?
Well, I think at the beginning of the crisis, so beginning of March, there has been definitely a lack of coordination, and many EU countries acted unilaterally when it came to closing the borders and restricting travel. And as I said, the COVID-19 pandemic hit different member states at different rates. And because, you know, we never experienced this, you know, this is the first time for the countries to combat this virus. So, but we did overcome these early difficulties, and the European Union, as you know, always grows in times of crisis. So we overcome this, I would say, in mid-March. And for example, medical supplies and equipment was distributed to other EU countries, or Germany flew Italian and French patients to Germany for treatment because we had the capabilities. Or when the EU country started to fly, you know, the European citizens from abroad back home, and we took other European citizens and we made sure that they got home. So these acts of solidarity were not only important because it lifted some pressure in some countries, it was important, it was a strong symbol and a strong signal, and it showed that the Europeans are able and can and will work together in difficult times. So last week, the EU head of states and governments, they agreed on a roadmap, on a joint roadmap towards lifting the COVID-19 containment measures. And they agreed to coordinate as much as possible to ensure a gradual and orderly lifting of these restrictions. And they agreed also on a joint roadmap for recovery and endorsed a 540 billion rescue package, which is quite a significant number. And this plan will work like the Marshall Plan after World War II. So, and it's of course in our own interest, you know, that the Europe economy, that it doesn't collapse, yeah, because it's in our own economic interest. And so I'm very hopeful that we can build on those acts of solidarity and ultimately strengthen the European idea. And I'm convinced that that Europe will come out of this crisis stronger than it went in, because we know we need each other. And it was always like this. The EU went through so many crises and only managed to overcome these crises together. Right. Thank you so much.
Thank you. We really appreciate it. Thank you so much, Joseph, for being with us and conducting the interview. This has been most interesting. Thank you. Take care. Be well.
Okay.